Hi, my name is Jamie, and I've been working with Signallamp now for almost 2 years. One thing I love about working from home is just being in the comfort of my own home. You have a lot of great support from the staff members. One thing that I really do like is you can always reach out to your supervisors. They always are there to support you. I do have some good days. I have some bad days. On my good days, I might only call, 10 to 15 patients. And some days, I get the providers call me and thank me for everything that I do for their patients. Patients go into the office and praise me for being able to reach out to me whenever they need me. A lot of times the offices are so busy that, the patients will call and have to leave a message and they don't get a return call for 24 to 48 hours. The great thing about Signallamp is that they're able to call me and I'm able to give them a call back usually I try very hard to call them back within 20 to 30 minutes. And they know that I'm there for them. Then I'm able to reach out to the provider and see what the provider's recommendations are and get back to that patient. On those bad days, I might call 30, 40 people and only reach 10 people. However, those bad days, might only be once or twice a month. Some months there might be 10 or 15 of those days. But those good days by far outweigh the bad days. When I first started, was I hitting my numbers? No, it took me several months to, build that relationship with my patients. Now there's days where I struggle to get to all of my calls because my patients know they can rely on me. Once you build that relationship with that patient, they're going to call you and say, hey, Jamie, I need that medication refill. Or, hey, Jamie, can you please reach out to Dr. So-and-so and let them know that my blood pressure today was this, it was this the day before, or my blood sugar was this, what do I need to do? Or what are your recommendations? Do I need to, change my medication? Do I need to increase this? Do I need to decrease this? It's all on that patient relationship. I think that, once that patient realizes that they can rely on you, they're going to call you before they call that provider because they know that they're going to be able to get a hold of you before they get a hold of that provider. Another thing that I think is very imperative with this job is time management. A lot of people think when you're working from home that you can just get up and put that load of laundry in, get up and, run and do this and run and do that. That's something that with this job, you have to have that time management. You have that phone ringing, you have that patient relying on you. And if you're up running around and doing a lot of different things, you're not there to answer that phone call. My day, when I first start in the morning, I kind of look and see who I need to call that day. Since I have been working with Signallamp for 2 years, I know my patients. I know which patients I'm going to be on the phone with longer and which ones aren't going to talk as long. Knowing your patient and building that relationship is key with this job. And getting to know your provider as well. That is important too. The better you know your provider and build that relationship with your provider, the easier you're going to be able to perform your job with Signallamp as well. I can't say enough good things about Signallamp. I have been very happy with this position for the last 2 years. It was the best move that I've ever made. I was a little concerned about losing my skills when I left bedside, but I have to say that the clinical my critical thinking skills that I use in the 8 hours that I work daily with Signallamp is by far more than the clinical skills that I use in a 12-hour shift. I never have the same phone call ever. So I'm constantly having to use my critical thinking skills daily with Signallamp and on every different call. And that makes me a better nurse. It makes it very rewarding for me. I can't tell you how many lives I've saved in the past 2 years. This is what's great about Signallamp, is that we are that middle person and we are saving lives. And I think that's amazing.